When you think heart attack risk, what's the first thing that pops into your head? For most of us, it's high cholesterol, right? We've heard for decades to watch our LDL, that so-called bad cholesterol. But what if I told you that's not the whole story? What if, for most people who end up in the hospital with a heart attack, high cholesterol actually wasn't the problem? Well, the truth is way more surprising, and it all starts with one incredible number.
75%. Just let that number sink in for a second. According to a huge study, that's the percentage of patients hospitalized for a heart attack who had cholesterol levels that were considered totally safe by national guidelines. We're talking 3 out of every 4 people whose cholesterol numbers would not have set off any alarm bell.
The UCLA Health study that found this was pretty blunt about it. The vast majority of these patients, on paper, looked fine from a cholesterol standpoint. I mean, this finding completely turns our conventional wisdom on its head and really forces us to ask a huge question. What have we been missing?
So if it's not high cholesterol for most people, what is it? This is what we're going to call the cholesterol puzzle. For decades, the entire medical playbook has been focused on one thing: lower your LDL cholesterol to prevent heart disease. But this data, it suggests that's just one piece of a much, much bigger puzzle.
So, to be clear, the conventional wisdom isn't exactly wrong, it's just incomplete. Focusing on LDL cholesterol has definitely helped a lot of people, but it hasn't solved the whole problem. It's kind of like trying to finish a jigsaw puzzle when you're missing a giant chunk of the pieces. And it turns out the cholesterol number isn't the only surprising part of the story. The patients themselves are not always who you'd expect.
We tend to picture heart disease as a problem for older folks, right? But the data is showing a really disturbing trend. While overall rates have been dropping for some people, there's one group where the numbers are actually going in the wrong direction.
That's right. Over the last couple of decades, while we've made some great progress in older populations, the number of heart attacks in adults under the age of 45 has been climbing. This just adds another fascinating layer to our mystery. What in the world is driving these heart attacks in younger, seemingly healthier people?
Now, when you look at these young heart attack patients, the traditional risk factors are definitely there. Smoking is a huge one, super common. Same with things like abnormal lipid profiles, that's dyslipidemia, or a family history of heart problems. But, and here's where we circle right back to our puzzle, even with all these factors, so many of these young patients still have safe LDL levels. There has to be something else going on, some hidden variable that we're not measuring.
And that brings us to the main event, the big reveal of this whole explainer. The missing piece of this puzzle isn't something you can control with diet or exercise. No, it's a largely unknown, genetically driven risk factor that's been flying under the radar for way, way too long. So meet lipoprotein A, or LPA for short. The easiest way to think of it is like a cousin to your LDL, or bad cholesterol. But this one has an extra sticky protein attached to it that makes it much more dangerous. It causes inflammation and helps build up that nasty plaque in your arteries. And here is the absolute most important part. A standard cholesterol test does not measure it.
Now, the traits of LPA are what make it so unique and so critical to know about. For one, your LPA level is up to 90% determined by your genes. You get what you get, it's set when you're a little kid around age 5, and it stays pretty much the same for your entire life. That means that all the things we normally do for heart health, eating better, exercising more, they won't budge this number. Even statins, the #1 drug for high cholesterol, don't lower it. It's a fixed, inherited risk.
So, you might be wondering, okay, but how common is this really? Shockingly common. About 1 in every 5 people on the planet, that's 20% of everybody, has elevated levels of LPA. That means in any random group of your friends or coworkers, there's a really good chance someone has this hidden genetic risk factor and has absolutely no idea.
And this is where all the dots connect. This is how LPA solves our puzzle. Studies have found that nearly a third of young heart attack patients have high LPA, even when their LDL cholesterol levels look great. This is the hidden variable. This is how someone can follow all the rules, eat a perfect diet, work out, have good cholesterol, and still have a massive heart attack.
So, understanding this hidden risk is changing everything. It's forcing a huge shift in how we think about screening for and managing heart disease risk. And naturally, this new knowledge is leading to new tools and new strategies.
For example, while statins are still a cornerstone for lowering risk, the whole field is evolving. We now have newer drugs, like something called PCSK9 inhibitors, which are just incredibly effective at lowering lipids. And they can reduce cardiovascular events just like statins can, but without some of the same side effect concerns. It's just a great example of how medicine is getting smarter and more targeted about how we manage our own individual risk profile.
Okay, so this all leads to the most important question of all. What does this mean for you? How can you take this information and actually figure out your own complete cardiovascular risk profile? Well, the answer is probably simpler than you think.
Because of all this growing evidence, major medical organizations like the National Lipid Association and the European Society of Cardiology are now saying that all adults should get tested for LPAA at least once in their life. Just a simple one-and-done blood test can reveal this hidden risk.
And knowing your LPA number is so powerful. I know what you might be thinking. If I can't change the number, what's the point? But the knowledge is incredibly actionable. If you find out your level is high, it means you and your doctor can get way more aggressive about managing all the other risk factors that you can control, like getting your LDL cholesterol and your blood pressure as low as you safely can. It lets you see the full picture.
So I'll just leave you with this one thought. Almost all of us know our blood type, right? It's just a basic piece of health information that you learn once and you know it for life. Well, the medical world is now starting to see the LPA level in the exact same way. It's your one-time number that can help guide your health strategy for the rest of your life. So, do you know yours?